Hello, everyone. You are welcome to this recording. This is a special recording for all of you who have taken the course on drugs, therapeutic drugs, as well as substances with abuse potential, who wish to understand the dynamics of the drug use, as well as the properties of the drug. So I've made this recording to supplement the class lectures we had a few weeks ago. And so we will quickly look at this within the shortest time that we can have. All right, so I'm going to share this video quickly. I want to share all right, so here we go. Okay, so we're looking at substance use and drug addiction, public health implications. So we're going to introduce this aspect of the basic principles of drugs and how they are used in therapeutics and some of the properties of drugs that will interest those in the health sciences and medical sciences. All right, so we're going to cover the following areas. We're going to cover pharmacokinetics and pharmacodynamics. We're going to identify what pharmacokinetics is and what pharmacodynamics is. And we're going to look at the characteristics of drugs that we refer to as pharmacokinetic characteristics, and then also look at the mechanism of action of drugs, covering pharmacodynamics. Then we'll review types of effects of drugs and how we classify drugs. And then drug toxicology. We're going to look at adverse drug reactions, and then we're going to focus a little more on substance use and substance abuse and their implications for public health principles. All right, so let's start with pharmacokinetics. So we'll look at pharmacokinetics in a moment, briefly, nothing very sophisticated or deep, but I just want you to understand what pharmacokinetics is. And this is what the body will do to the drugs when drugs are taken. And when I say drugs, it covers all substances, all chemical substances that can modify physiological functions of the body, all right? So the idea that when you use the word drug, it refers to a particular class of drugs that have abuse potential. And when you mention medicines, it refers to therapeutic drugs. No, that is not correct. All right, so let's hit the road now. Right, so pharmacokinetics, that's the first aspect we're going to take up now. This is the process describing the mechanism and transformation by which all drugs that is administered, undergo as it passes through the body system. So when you're taking a drug by any route, the body will do some work on the drug, allow the drug to absorb across cell membrane, diffuse, and then you have some metabolic activities on the drug to transform it, and so on. So we're going to look at this very briefly. So pharmacokinetics describes how the body can change the drug constituent and characteristics while it passes through the organ system and circulates throughout the body system. All right, so drugs are administered for the purpose of producing therapeutic effect. So drugs are not necessarily, in fact, it's not the purpose of drug for entertainment. They are for treatment of human and animal diseases. But then for you to be able to get the benefit of the drug for which it has been prescribed and administered, it has to first arrive at the site where the drug would produce the effect. So it must move from the mouth through the body system to whatever parts of the body that needs the drug action. Well, let's look at the journey the drug will take around the entire body system. So there are a series of events that will cause the drug to change, making it more potent or less potent. So administration is the first. The drug must be administered, as I mentioned in the previous slide. For this drug to have any beneficial effect, it has to be administered. So administration is achieved by the following means. We have the oral gastrointestinal. So the drug has to be administered through the mouth or sublingually or buccally. So the mouth will require ingestion. All right, the drug is taken by oral, by mouth. Ingestion takes place. So the drug is taken with water and then swallowed. Then it goes down into the stomach. Now, sometimes the drugs are administered under the tongue. That's the sublingual, under the tongue. And then absorption takes place right there under the tongue, because if you look at under the tongue, you see vessels, blood vessels, a lot of blood vessels pass through there. And buccal is by the cheeks, the cheeks by the side here and here, under the cheeks. The drug can be placed inside under the cheek and absorption takes place. Right, so that is oral or gastrointestinal. Then we have parenteral. So generally the oral gastrointestinal system are enteric. Enteral means the gut system. So enteral or enteric. Then we have parenteral. By injections. There are different types of injections. We can have intravenous, intramuscular. So we've discussed this. Intravenous into the vein, the drug can be administered directly into the blood circulation through the veins. Then it can be administered into the muscles, and the muscle mass have a lot of blood vessels, including blood vessels that will enable the drug to diffuse into the general circulation. Then we have pulmonary, by inhalation. Drugs can be inhaled into the lungs as volatile liquids and sometimes gases, especially anesthetics. When you want to anesthetize somebody under a surgical system or surgical procedure, some gases are inhaled, like nitrous oxide, or all the volatile liquids that can be used for producing general anesthesia. So inhalation, and the drug, the gaseous drug will pass through the pulmonary system into the general circulation. Then we have topical, that's on the surface. Surface mucous membrane, absorption of drug takes place right at the point where the drug lands. So we can see that the drugs that are used for treating asthma, emergency asthma, and you inhale something, it's not really pulmonary. We cannot class it here. We actually would put it as topical, although the method of delivery is by inhalation, but the drug does not diffuse into the general circulation to produce the action desired. So the drug is inhaled, and then it lands on the bronchi muscles to cause dilation of and relaxation of the bronchi muscles. So immediately delivery is done. We're still on that pharmacokinetic. After delivery into the site, absorption takes place immediately. All right, so an administered drug is naturally absorbed, partially partly because of the nature of the drug. So, and also how the membrane is structured. So, absorption requires that the drug is transferred. Okay, the drug is transferred across the cell membrane. Okay, so we have definition for absorption, that certain mechanism that takes place. So this happens at the site of administration into the general circulation. So that's the mechanism of delivery into the general circulation, so that the drug elements will be circulated throughout the body system. Right. If it is by enteral routes, the certain organ system would first of all receive it, like the liver. The liver will do some things to the drug, and then will now circulate to brain, muscles. All right. So the mechanism for absorption, there are two mechanisms there. We have diffusion and osmosis. I'm sure we are familiar with what diffusion is and what osmosis is. But the combined mechanism is how we achieve absorption. Now, the moment the drug gets into the general circulation, the liver receives and begins to biotransform the drug. So what is biotransformation? Now, to understand this, first of all, we want to identify the nature of the drug. So drugs are toxic, and the body is prepared to protect itself by this mechanism of biotransformation. So when the drug gets into the liver would change it through biochemical processes. All right, the biochemical processes will either, there are many mechanisms by which drugs are transformed biochemically in the liver. So biotransformation is the process of metabolizing drugs to change it from very active compounds to inactive compounds or products that are less toxic and also water soluble, because most of the drugs are fat soluble. And if they are fat soluble, they will continue to stay within the body system. So once the liver converts them to water soluble metabolites, they will now diffuse into the kidney, where they are excreted in the urine and their actions terminate. So all drugs, their actions are limited to a particular time when the drug is completely metabolized and excreted from the body. There are enzymes that do this. These enzymes are located in the endoplasmic reticulum, known as microsomal enzymes, and they are responsible for the transformation of drugs that are active to metabolites that are inactive, or sometimes the reverse. The drug may be inactive but transformed to very active metabolites. So we have many examples of that. It happens. All right, it happens. A case in point here is the transformation of a particular analgesic that was very popular in the 70s and the 60s, phenacetin. Phenacetin was used for treating headaches and pain. It was initially thought that this phenacetin had direct analgesic effect until it discovered that the metabolite paracetamol was responsible for the analgesic effects of the phenacetin. And today, phenacetin has been discontinued, partly because of the damaging effects to the liver, to the kidney, sorry. Right, so we now move to excretion. So once the drug is metabolized, it is excreted from the body, and they do not remain indefinitely in the body. So there are systems that take care of these drugs. The liver will metabolize, the kidney will excrete. All right, so the metabolic activities of the liver enzyme facilitates the process of transforming lipid-soluble drug, which otherwise would have remained in the body almost forever, to water-soluble metabolite, which the kidney flushes out of the body as urine. All right, so we quickly go to pharmacodynamics. So what is this pharmacodynamics all about? Well, we have looked at pharmacokinetics, as the drug is moving through the body and what the body is doing to the drug itself, the drug molecule. Now, the drug has arrived at the point where it is supposed to exert its actions and effect. So this is where pharmacodynamics begins to play its role. So we need to understand what pharmacodynamics is quickly. Now, the drug now at the site of action produces effect. So pharmacokinetic enables the drug to get to its site. And when it gets to the site, pharmacodynamics begin. So what is pharmacodynamics? Pharmacodynamics is the study of the interactions between a drug and its molecular target located inside or on the surface of cell membrane. So inside the cell or on the surface of the cell itself, the cellular membrane, to produce pharmacological responses. There are many responses according to the organ of primary action of that. Right, so the mechanism of action of a drug owes its dynamics to this principle that we have just explained. So there are receptors, there are macromolecular structures that are found on the surface of the cell membrane, and sometimes inside the cell itself, various parts of the cell, all right? So you can have on the microsoma, on the endoplasmic reticulum, you can have on the mitochondria, anywhere they could have, you know, these very specialized cells. Now, very interesting that drugs have actions, effects, which are very specific and they are selective. They are specific because they have target molecules that these drugs will bind with to trigger cascade effects within the cell itself, modifying the physiological function of that particular cell. And because the cells are numerous, so once these drugs trigger this action, the whole physiology responds to it. And so the receptors, these macromolecules, are the reason why drugs are specific and they are also selective, because these macromolecular substances of protein nature are distributed not evenly. All right, certain organs have more than other organs. Right, so drug receptors are components of the cell of the body that mediate the drug activities. Without these specialized substances, no action would take place. And so drug receptors are macromolecular substances of protein structure that are located on the surface, or sometimes you find them inside, like I've explained. And when these structures bind with drug, they change the structure of the receptor, sometimes to facilitate diffusion of certain molecules, special molecules. For instance, glucose will not enter into the cell without activating the gate. All right, so insulin will activate the gate to enable glucose to diffuse into the cells where mitochondrial activities and all the enzymes there would react and produce energy. I'm not trying to be complex with this just because I have to explain some things and give some illustrations. So, so these drug these drug receptor combinations are very, very essential in explaining how the drugs work. And many research have been conducted, explanation of their dynamics are available, and we're beginning to understand exactly what is happening intramolecularly or intracellularly. Right, so I've talked about specificity, that drugs are very specific. It's not like where we assume that there's one drug that will produce all the therapeutic effect there are. I doubt if such a drug exists because of the specificity of the molecular structure of the drug and specificity of the receptor structure that would fit like key and lock. And then only drugs shaped to fit the particular receptor molecule will trigger the cascade of action required to produce the result. Selectivity, some of these activities are not produced in many organs of the body because those receptors do not exist there. So an understanding of how drugs act will require in-depth understanding of the characteristics of what goes on at the site, all right? So the explanation is beyond the scope of this particular presentation. So we have various types of drug effects. Effects depending on the organ of primary action. So effects of drugs are outward manifestation of the physiological characteristics of specific organs in which the drug will act. So no drug would act in a particular organ that organ cannot produce the effect physiologically. It will be unheard of, all right? So every organ in the body will respond according to what they are supposed to be doing naturally. All right, so let me go quickly through. Okay, we'll just move on. Then we now want to talk about drug adverse effects, drug toxicology. Drugs are not all of them safe. No drug is safe because they are all chemical substances. And these chemical substances interact with body systems to modify physiological characteristics of specified organ systems. So in toxicology, we study the undesirable effects of drugs and other chemicals in the body. So all the drugs that we administer, they're all chemical substances, and we administer them because there is a reason. There is a therapeutic need for them to come in and facilitate recovery. Now, certain drugs, when taken, will destroy the cells and destroy metabolic mechanisms that drive life processes to produce health hazards. So the physicians, the clinicians understand this very well because they have studied this subject thoroughly. So the administration of such drugs are under very strict regulation and observation. All right, so adverse drug reaction is considered only when reactions occur in doses normally employed in therapeutics. Okay, so adverse drug reaction, we can have side effects, we can have toxic reaction, we can also have allergic reactions. So for side effects, they are regarded as extension of the pharmacologic effect of the drugs which have been administered and not required at the time of therapy. So a drug may have two or three receptors that they react with, or that the receptors are distributed different places of the body. And when these drugs are administered for one particular desired therapeutic effect, the other actions that can be produced in other parts of the body will also be produced because they don't just switch off and switch on. So those other actions in other parts of the body that are not required at the time of treatment becomes a side effect. Okay? So for instance, you're treating diarrhea with drug that would reduce motility, intestinal motility. And as the intestinal motility is achieved, reduction of intestinal motility is achieved, you would now have the other aspect that the drug has in causing dryness of mucus secretion. So such drugs will not dry, they will have dry mouth. All right? There are many drugs like that. Most drugs produce side effects. Excuse me. Now we have toxic reactions. These are direct damaging effects of the drug on biochemical pathways and tissue integrity. So they are toxic. They destroy. If taken in very large doses, they destroy the system completely and they become poisonous. Then we have allergic reactions. Allergic reactions are a particular one, but it's not that everyone who takes the drug will produce allergic reaction. Because exposure to a particular drug produces unusually abnormal reaction that comes up suddenly. And this is because certain portions of the immune system are activated, allergic. So you have the antigen will be the drug, then the body must have produced antibodies that will react and release some substances like histamine and so on that can cause rashes and sudden anaphylactic reactions. Okay, so that brings me to the major area. What I've presented now, just to give us an idea of what drugs can do generally. But now, one of the adverse drug reactions that is of concern and very important is substance abuse. So we're going to take the time now to look at substance abuse. We begin with the definition. Drug abuse and drug misuse. We want to find out what's the difference between the two: drug abuse, drug misuse. Now, these are two different concepts. Drug abuse is a different concept, drug misuse is a different concept, though they involve use of drug, but the types of drugs that are involved are quite different. So let's look at drug abuse first. Drug abuse is the excessive, remember, the word excessive and continuous self-administration. It has to be self-administration of mind-altering. It must be mind-altering, not just any drug. Mind-altering substances for the purpose of changing mood, the mood, euphoric effect desired, without due consideration of any medically or socially acceptable pattern. That is what drug abuse is. Excessive and continuous self-administration of mind-altering substances for the purposes of changing mood. So, entertainment, all right? So such materials, and it has to be a particular type. Not every drug can be abused. So only those that affect the central nervous system, mind-altering. Now, look at drug misuse. Drug misuse may be described as the improper use of drugs, such as improper dosages, you have used too much, or inappropriate indication, or probably use of wrong route of administration. There are many ways in which misuse can be carried out. For instance, I know some of the people who are laborers, after working hard during the day, they can consume very large numbers of tablets of paracetamol. That's misuse. Now, the term drug abuse is one that describes a serious conditioned behavior problem emanating from the use of centrally acting drug and other non-therapeutic substances. Non-therapeutic would consider some volatile liquid like Evostick All right. So, but central to this definition and classification of drug abuse is drugs that act on the brain cells to change and cause euphoria, trigger feeling of well-being. Okay, so there are two mechanisms that are proposed that are responsible for addiction. All right, the addiction that comes as a result of drug abuse. Drug abuse is a behavior. Right, so there are two proposed mechanisms. One is tolerance, and the second one is dependence. Tolerance and dependence. And so we can quickly define tolerance. This is the definition. Tolerance, please note this definition. It's very interesting and very operational. Tolerance is defined as a diminished response produced in the body following sustained administration of a drug in which increased amounts are needed to produce effects of equal magnitude. Very important. The drug has action on the brain cell to trigger its effect, but then the effect triggered the first time, the second time will not be exactly the same because the response has diminished. Because sustained administration results in diminished responses. So you can never get the level of response the first time. Each time the responses are going down. And then there is a need to increase the amount of the drug to to maintain that response so that it won't go down. But that's an illusion. It never happens unless you take an overdose. Now, this phenomenon involves some psychological characteristics which tends to perpetuate the habit in the user. So the user takes more to produce the responses that they desire because there is this diminishing response, and it continues in a vicious cycle. Now, tolerance is described when the drug action is started. So this is what begins the journey. Tolerance, the body begins to tolerate, requiring bigger dosages to produce action that is the same. Then we have what we call drug dependence. First, we described tolerance. Now, drug dependence is the second part. Drug dependence is the physical, it has a physical and psychological dimensions to it. So the physical dependence is a state of adaptive balance in which develops in the individual, allowing normal functioning only as the drug is present. And on withdrawal of that drug will produce severe physical reaction as a result of the disturbed adaptive balance. So it's like there's a balance, and you're dropping something on one side of the balance and you're countering it on the other side to keep the balance. The moment you remove one, the whole thing collapses. So that is what we're talking about here. So the drug presence and the changes that are taking place in the brain all combine to keep the drug behavior on. So physically, yes, once the drug is removed, the disturbed adaptive balance will create very severe physical reaction. Apart from the physical dependence, we have psychological dependence. This is also another aspect that makes the treatment and recovery from drug exposure, this substance with abuse potential, recovery from substance with abuse potential, very difficult. Psychological dependence here is characterized by an overwhelming desire in the individual to take the substance, even long after its habitual consumption has ended. So the drug itself has the ability to produce footprint in the brain cell, footprints, signature in the brain cells that will cause a memory and desire to go back even after the person has stopped taking the drug. And this psychological dependence is the reason why people who have been treated for drug use, after a while, they still relapse. So that memory is still there, the footprint, we call it. Now, this diagram describes the vicious cycle, the vicious cycle that reinforce this drug abuse. So we start off with here, the taking of the drug, consistent exposure of brain cells, develop tolerance. Brain cells now have to function only with that drug present, and will create physical dependence and also psychological dependence. And then the thing continues round and round and round. And each round, it goes up to the next level, more drugs, more drug quantity. And by the time the person has been established in this vicious, the quantity of drugs required and demanded now becomes very, very, abnormally high. Now, some questions are asked. Why do people take drugs? Why? Is there any reason anyone would want to take drugs? Yes. We have discovered that the choice of an individual to make one or more drugs with abuse potential the way of life for extended period of time is a response in such an individual to some unmet inner need, something inside you, some condition, depression, or some feeling of inadequacy, unmet inner need, all right, drives this behavior, all right? So this is strongly related to the extent of emotional disturbance that is present. To now balance or remove this emotional disturbance, people will quickly turn to drugs. So drugs now provides an easy escape from an individual's difficulties, or provides the excitement that is lacking in one's life. But then the physical transformation through which the body is passing is no better to cope with the difficulties than at the beginning of the drug experience. So it now turns out to be the wrong choice to make by turning to drug to solve these problems. All right, so this is the basis of the withdrawal symptoms, that at the end, you are worse off. You are worse off, even at the point of death, and then damaging your mindset, damaging your psyche, damaging your physical body, damaging your reputation. So it's not worth it. It's not worth it. Right, so quickly, there are 4 progressive patterns of abuse that have been identified. We have experimentation, social pattern, episodic pattern, we have compulsive. By the time one gets to the compulsive, the addiction process is complete. Experimentation, you can withdraw. Social, you can withdraw, but by the time you get to the last level, it's disaster. So the pleasurable effect experience provides positive reinforcement, that's the reward, for continued use in most situations. If the drug use is continued, that's at the experimental level, tolerance to the drug and the euphoric effect we know will develop. That's a diminished response that I talked about earlier on. And consequently, more drug must be used more frequently to achieve the same effect, which I explained in the definition of drug abuse. So this is it here coming up. Now let's look at types of drugs that are classified. 2 types of drugs that are abused, that have abuse potential. So we have on the left here, central nervous system depressant. On the right here, we have central nervous system stimulants, and they are listed here. The ones that are yellow here are the commonly used ones. So we have at the top of the central nervous system depressant, heroin, followed by opium, opium produces morphine and codeine as the natural compound in opium. But heroin is a synthetic version of the two. Right? Heroin is a direct product from opium, but then it can be synthesized, crystallized, and sold as an injectable material. Then pethidine comes. So these are all in the hierarchy of highest addictive potential, and then at the bottom, least addictive potential. So we have heroin, opium, the opium product are these. Pethidine is synthetic, methadone is synthetic, fentanyl citrate, synthetic. Then we have tramadol, which is popular here. We have pentazocine. Then we have barbiturates, phenobarbital, and the other barbiturates. Then we have benzodiazepines, Valium, Lexotan, and the others. Then we have alcohol, spirits, different concentrations, then solvents that we use, like Evostick. They are all, people have all used these. Then on the right here, we have the stimulant, central nervous system stimulant. We have cocaine at the top with its crack version. Then we have LSD, lysergic acid diethylamide. It's the one that produces hallucinogen. You hallucinate. You begin to see things that are not there. And sometimes one would think that you can fly. You have wings. So you find some people who go to tall buildings and they think they can fly. And they jump off. They just land and and land dead. We have amphetamine and various versions of the amphetamines. Then we have cannabis, that's the Indian hemp, then caffeine, coffee, tea, then nicotine in tobacco. These are all compounds that increase the activities of the brain tremendously. Cocaine, LSD, amphetamine, they all increase the brain activity, and the brain will be seeing things, will make you see things that are not there, because it distorts the image that you are seeing, and you interpret them as. Right, so quickly, let's see where they are coming from. All these drugs, where are they coming from? We see the types of drugs. We have cocaine. This is what it looks like. And it comes from this area of the world, cocaine region. This is where it is in South America. You have Venezuela, Colombia, Ecuador. Then we have Peru, Bolivia, and Paraguay. These are all countries where these compounds grow, like shrubs, naturally, everywhere. And Colombia is the number one of it, and Venezuela. So you have the drug barons there, and the laboratories where they purify the coca leaves. The leaves are the ones that produce the substances that are crystallized and refined and crystallized. Now, this is the opium, all right? This is opium seed. The poppy seed grows in these parts of the world. So this is what it looks like. There are some liquid that, comes out of it, white liquid. Now, these are, when you split this seed, it produces the liquid, and it's the liquid that contains the morphine, codeine, and they turn this into heroin. So all of these countries here in Asia, we have Afghanistan somewhere here, all right? We have Pakistan. These are countries where you have all of this growing around here, all these Asian countries down here. Okay. Then we have the other one, Indian hemp, the cannabis. This is what it looks like. It grows tropical. So in India, we have it, Pakistan, India, so this is cannabinol. The compound that is in it is that it contains cannabinol. All right. Right, concepts, let's quickly look at understanding natural history of disease, pathogenesis, and how do we prevent it? Well, let's say prevention is better than cure. Let's quickly look at these definitions. So prevention would be action aimed at eradicating, eliminating, or minimizing the impact of the disease or the disability that will result. And if none of these are feasible, retarding the progress of the disease and disability, it's all equally referred to as prevention. We prevent the damage. So there are various stages in which you can prevent. It will be best to prevent it at the earliest stage of the disease trajectory. You don't wait until the damage is done before you begin to institute some prevention activities. So you early diagnosis, employ your prevention technique that fits the particular stage in which the disease is progressing. Right. Now, the concept of prevention is best defined in the context of levels. All right. So we have various levels. Presently, we have primordial, primary, secondary, and tertiary. Primordial, primary, secondary, and tertiary prevention. So this is what it looks like. Putting everything together, and the levels of prevention at the top with the modes of intervention in the middle, and this is how we've interfaced the clinical and public health interface. This is where the responsibilities, whether public health practice responsibility covers primordial and majorly primordial and primary prevention levels with the corresponding interventions, whereas clinical science practice will cover part of secondary and tertiary prevention. So what do these prevention, what are they preventing? Now let's look at the primordial prevention. That's the point at which the disease-causing agent, whether it's a drug like tobacco, smoking, alcohol, is about to invade a community. So to eliminate all that risk factors, there must be policy intervention. So the intervention here is a policy thing that will legislate. All right. So in primordial, legislation is very important. So public health people will now provide the evidence that these substances are not desirable in the community. Policies are raised and implemented to separate these risk factors from the humans in the community. But when we fail to achieve this, primary prevention is the next thing we do. In primary prevention, we have two activities: health promotion and specific protection. These are the two interventions that can be applied at this point. So the interventions, health promotion, specific protection includes health education under health promotion, health education, service improvement, policy advocacy. These are health promotion components. Specific protection, immunization, bed net, nutrition, safety, safe sex, seatbelt, among others. But then if at this point when the disease-causing agent and the individual people in the community population, you are not really touching that much, but people can protect themselves through primary prevention by preventing. Now, if we cannot do that, we missed it. Secondary prevention comes in where we have early diagnosis of screening or community diagnosis. So we pick the disease at its earliest symptom presentation so that treatment will be very effective. But when people come in late with the disease well established, then treatment is what will go. So we have medical treatment, surgical treatment, nursing care. Then we have adherence. Adherence to the treatment is very important for it to be successful. So this is where the overlap comes in. Now, when we miss the treatment at the stage where treatment will be very effective and disabilities and damage to system are now beginning to appear. We need to diagnose and prevent the disability from getting worse. We have disability limitation and then finally rehabilitation. Right, so these are the methods of prevention. Thank you for watching. We will see you again. If you have any questions, do not hesitate to reach me and then let others know about this. This is an important subject, especially for adolescents, for them to stop exposing themselves to drugs. It's not a good habit. Most people end up dying unnecessarily, cutting short your career, cutting short potential you have. Thank you very much for watching. Bye-bye.